When someone finishes active cancer treatment, the common reaction is to celebrate. Friends and family throw parties, the hospital rings a bell, and everyone assumes it's time to pick up right where life left off. This timeline shows the disconnect. Active treatment runs on a highly structured schedule, but once you hit the final marker, that structure vanishes. The density of medical appointments drops to zero. Losing this daily expert oversight leaves many survivors feeling deeply vulnerable. A sharp friction exists between the desire to return to a pre-cancer routine and the reality of a body still dealing with intense exhaustion and a mind processing the trauma of the illness. Navigating this gap requires a map. We will break down the distinct phases of survivorship, build a step-by-step care plan protocol, and address a critical hidden burden that affects the whole family, the reality that caregivers are survivors too. Managing cancer long-term requires a deliberate strategy to navigate the active transitions ahead. The survivorship journey follows an evolving three-phase life cycle. This flowchart breaks down the timeline. Phase 1 is acute survivorship, defined by constant medical oversight, tests, and tight schedules. Phase 2 is extended survivorship. The medical icons disappear as you enter the post-treatment window, where physical recovery begins. This phase involves a specific trade-off. Losing the medical safety net increases fear, but the lack of structure provides independence. Phase 3 is permanent survivorship. The space fills with daily life routines, balanced by periodic medical monitoring. During this phase, you are actively managing chronic late-stage effects. For many, this means adapting to persistent neuropathy in the hands and feet, or navigating the cognitive difficulties commonly known as chemobrain. Successfully moving through these phases requires adapting to a resilient, future version of yourself. When treatment ends, the physical baseline for a new survivor is typically a state of persistent fatigue and altered bodily function that outlasts the final medical procedure. This matrix charts the effort versus impact relationship. We measure initial effort on the horizontal axis against long-term well-being on the vertical axis. Notice where physical activity and nutrition plot out. The activation energy required to maintain movement or a balanced diet is massive. Committing to that short-term effort yields specific clinical outcomes. Regular exercise and proper nutrition directly improve immune function, enhance baseline energy levels, and stabilize your mood. Emotional recovery demands an entirely different effort. Survivors carry the hidden weight of chronic anxiety and survivor's guilt. Mental health counseling requires maximum initial effort. It takes painful vulnerability to seek help, yet yields the highest long-term well-being on the chart. Physical and emotional recovery is an active investment, trading short-term comfort for a sustainable survival strategy. This management extends beyond the patient. To get through active treatment, caregivers often suspend their own physical and emotional needs to coordinate the immediate medical crisis. Look at this checklist of burnout indicators. The moment the patient's treatment ends and the adrenaline fades, caregiver exhaustion suddenly catches up to them. Emotional burnout, relationship stress, and physical fatigue become apparent. Caregivers make a distinct trade-off, sacrificing their own mental health and stability to ensure the patient survives the acute phase. Entering the extended survivorship phase requires an urgent pivot. Caregivers must now prioritize their own self-care, counseling, and connection with peer support groups. Taking that time often triggers intense guilt. It feels difficult to step back from serving the patient, especially after doing it single-mindedly for so long. Caregivers who prioritize their own recovery establish the structural stability required to prevent the family unit's long-term collapse. To replace the passive anxiety of post-cancer life with structured control, you need a formal survivorship care plan. Think of this plan as a blueprint. Step 1 compiles a definitive summary of your diagnosis and treatments. Step 2 establishes a schedule for future follow-up visits and screenings. Steps 3 and 4 document long-term side effects and set concrete targets for nutrition and movement. Building this plan involves a specific trade-off. It forces you to confront future medical risks and shoulder an administrative burden while you are still recovering. That upfront friction transforms the overwhelming unknown into an actionable, managed health strategy you can execute every day. True survivorship requires an active adaptation to a new baseline, focusing on the future instead of attempting to return to the past. For the patient, scheduling your recovery with the exact same rigor used for chemotherapy allows you to regain personal agency. For the caregiver, managing your own emotional recovery is the primary task once the immediate medical crisis has passed. While the patient and the caregiver experience the same cancer event, they must walk parallel, distinct paths toward recovery, navigating different obstacles side by side. As both enter permanent survivorship, focus shifts toward finding meaning. This often takes the form of engaging in patient advocacy, mentoring others, or pursuing long-postponed personal goals. Finding that meaning requires a deep acceptance of the permanent physical and emotional changes the illness left behind. Life after cancer looks different than anyone expected. By methodically managing these trade-offs, both survivors and caregivers can build a resilient, thriving future together.